Hey guys, this is Dr. Erin Sousley at Summit Family Chiropractic here in Coeur d'Alene. We are on Government Way, just right across the street from Fuel Fitness. And I've been in practice for over 10 years now. I've seen thousands of patients, and I've helped people, for anywhere from low back pain, neck pain, headaches, all the way to people with, more serious conditions like heart disease, diabetes, Alzheimer's, and everything in between. And what's really interesting is that over the years, after seeing thousands of people, one thing that I hear often is that what we do here is so unique and different. And so what I wanted to do today is instead of telling you about what we do, I wanted to walk you through what an average office visit looks like for one of our patients. So follow me. So we do what's called corrective care. So corrective care is kind of like physical therapy and chiropractic combined. So it's not just go in, point to where it hurts, get adjusted, and walk out. It's a lot more in depth because our goal is to correct the cause of the problem and actually correct the shape and the structure of the spine, not just pop the back where it hurts. So typically what happens is when a patient comes in, after they've checked in, we do warm-up exercises to start. First thing we have patients do is we have patients do cervical traction. So this is an excellent way to not only stretch out the spine, but also get some fluid and some motion into the discs or the joints of the spine. So what Tori's doing right here is cervical traction. And as you can see, as she's doing this, it's literally pulling her spine or stretching her spine from top to bottom. So it's a great way just to take pressure off of the muscles, the joints, and the nerves in the neck and the upper back. Second thing we do is this is Casey, and you'll see that Casey is doing wobble exercises. So again, this exercise is designed to warm up and loosen up the lower spine and the hips and the pelvis. I see so many people that because they sit for most of the day, that they really have locked up hips and pelvis, and their lower back is really, really hard to correct or adjust because of that. So this exercise is fantastic at loosening all that up and warming that part of that. Then we make our way into the adjusting bay. So one of the things that we do that I really like is, I've been to places where there's no x-rays and it's very, very difficult to correct a spine and be really specific with adjustments without x-rays. So on just about all of our patients, as long as it's indicated, we take x-rays, and the value of that is, number one, when patients come in, they lay down, they're all warmed up, they're ready for their adjustment. Their x-rays are up on the computer screen every single time that I walk in. And then that way, I know exactly what the issue is, and it helps me remember what we're working on, what we're trying to correct, all their angles, measurements, any contraindications. I also have on here adjustment technique, so it's not all snap, crackle, pop manual adjustments in here. We do a combination of things. So I'm gonna go ahead and adjust Hannah so you can just kind of see an example of what we do, but the x-rays are a really big part of our technique. Turn your head that way. Good. Turn your head the other way. Good. Okay, now I want you to sit up. You can face that way. The other reason why I really like using the arthrostim is some people just really don't like to have their neck adjusted, or there might be contraindications. Like I see a lot of patients that have had spine surgery, like laminectomies, discectomies, spinal fusion. And so in those cases, my opinion is, less force and more specificity or more accuracy. So with the arthrostim, we can be really specific, and with the vibration, we can still be really effective without using a lot of manual force. And again, for people that just don't like to have their neck adjusted by hand, this is still a really effective tool to be able to do that. All right, your power's on. So the other reason why the x-rays are so important is because it's not just about identifying the problem in the very beginning. But after a series of adjustments, at the end of someone's care plan, we take post x-rays, and that way we can actually measure the amount of correction or the amount of change that's happened in their spine. Because far too often, people start feeling much, much better within the first week or two, but oftentimes it takes longer than that or a little bit more work to actually correct the underlying cause of the issue. After the adjustment, it's really important that we strengthen the muscles in the posture around the spine to get the adjustment to hold longer. This is one of the things that I hear all the time from people, especially people that have been to other chiropractors, and that is that they'll go in and they'll get adjusted, and then they'll walk out to their car, or they'll do some gardening in their backyard, or they'll pick something up at home just a couple of days later, and their spine goes right back out. There's nothing more frustrating, because either the chiropractor's closed on the weekend, or you got to jump back in there on Monday morning and get the same exact adjustment. And what you got to understand is that it's not the adjustments that fix the shape of your spine necessarily. It's all the muscles, ligaments, and tendons around the spine that create muscle memory and postural endurance.